currently, if you're aware, in Kenya, we are worrying about the Mpox, for example. Mpox has been reported in Kenya, but it didn't originate from Kenya. It was from Central Africa. And someone traveling from Central Africa came to Kenya and they've been diagnosed. And a few more cases have been reported. The same thing to COVID. COVID was first reported in China, but then it covered the whole world because people are migrating, they're traveling. So the issue is, as I travel, I may not know that I'm harboring an infectious agent that may be a problem to other people. And so that's where migration health is. So if you're coming from a war-torn country that the children have not been vaccinated fully, then those children are at risk of having a disease like polio, measles, and that can be spread easily to other people, especially those whose immune system is compromised. So, and that's why the alert, like we have to be aware, to be alive to some of these issues. That as Kenya is a hub of many people from conflict-prone countries. We have had Kakuma refugee camp for so long. We have had Dadaab for many years. And people are still coming to those camps. So how are they coming in? Do we have a system that is surveying them? Do we have a surveillance system in place that can contain any disease? Is it possible that the government, together with international partners, ensure that all these children coming in have been immunized, at the right time? They have all the immunization. And even the people coming in are screened for other infectious agents that are not in the country, so that if they have them, they are treated before it spreads to other people in the country. So if 2% of the 3 trillion budget that we run in this country went to research.
My name is Laventa Namai. I'm a first year student. This is my first semester. I'm doing clinical medicine as a course, and I'm happy to do that course. Today's event is very helpful to us health science students. It is leading us, or it is guiding us on how we can start up our own facilities and how to do research on diseases and how we can come up with cures and such kind of things. The challenges I have seen are mostly negligence and ignorance. Like, our people in our communities need to be educated much on how to take care of their health.
We have realized migration has led to that burden. You see, we have been told, for example, due to the dispute in Somalia, that's why we are still struggling with cases of polio, a disease that has been eradicated, but now it is coming up again because maybe in that country, vaccination is not so effective. So when they migrate, they are bringing the same cases in this country. So to me, maybe if those who are migrating from those places, they should be treated, they should also be vaccinated, and government should list strategies to ensure that those who are migrating to our country are well checked, maybe at their entry point, so that they will not spread those diseases in this country.
This time, our aim is to really have our local stakeholders, or rather our internal stakeholders, who are the students and staff, on the process and be able to show to the world whatever we are doing. And the other thing that really makes me happy is also to see the way the whole organization has been done, such that there will be a lot of interactions with the schools. I'm just hoping that it's not only the medical students who are here or the students in the College of the Health Sciences. I hope we are also encouraging that the other students also come to know what the college has in store, because nowadays research is multidisciplinary. As a health scientist, you will not work without an economist, because you must tell us about the socio-economic effect of whatever you are doing. What I'm saying is that for us, we want to begin it here, so that even as you grow, the longest time that you'll be in the university is during your undergraduate. You will never see this kind of a time. The others will be 2 years and or shorter. But the idea is that if you can be able to embrace what we are saying at your undergraduate, you have quite a lot of time to be able to interact with your lecturers, to be able to learn from them. And then for us, the teaching staff, we also have an opportunity to impact on these upcoming scholars, because one thing that I have realized is that scholars who are able to pick it up from undergraduate, they become very much accomplished scholars. And so I am looking forward to having a crop of scientists that will be more meticulous than we are, because they have started it early.